welcome to NSG 412, Study Session 11, Organization of School Health Services. Introduction. In this study session, we will discuss organization of school health services by stating the minimum requirements for setting up a health center and explaining the elements of school health services. Learning outcomes. When you have studied this session, you should be able to 1. Discuss the organization of school health services. 2. Highlight the elements of school health services. Organization of school health services. School health services, as an essential component of effective school health program, ensure that children are healthy and able to learn at all times. It is an essential component for achieving education for all, EFA, inclusive of children with special needs. School health services are preventive and curative services provided for the learners and staff within the school setting. The School Health Center. The Federal Ministry of Education, Nigeria, has stated the following as crucial for organizing school health center. 1. Should be sited in the school premise. 2. Must be easily accessible. 3. The center must operate every day during school or boarding hours. 4. The hours of duty must be convenient to learners and staff and include some hours before and after school for day schools. 5. Must allow participation of parents and guardians who wish to participate in the care of their child. 6. To the maximum extent possible, permit scheduled appointments that do not unnecessarily interrupt the student's classroom time. 7. The center must provide services to students in a manner which ensure the students and his or her family's right to privacy. Minimum requirement for setting up a school health center. 1. A space as wide as classroom for 30 to 50 students to be partitioned into. A waiting room, private examination room, a treatment or observation room with a minimum of 2 beds, bathroom and toilet facility. 2. Provision of safe water, e.g., solar-powered borehole or well. 3. Provision of a functional refrigerator powered by kerosene, solar, or electricity as appropriate. 4. Constant and regular supply of drugs and consumables according to the prevailing diseases in the community. Drugs should be provided according to the essential drug list. 5. Provision of regular power supply, either electricity or solar. 6. Provision of means of sterilization of equipment and instruments. 7. Provision of safe disposal of medical waste. 8. Constant and regular supply of stationaries for proper record keeping. 9. Provision of adequate health record keeping system like record card, computer system, etc. And lastly, provision of transportation to referral centers or visits to school clinic if located elsewhere. Elements of SHS. 1. Pre-entry medical and dental screening. 2. School health record. 3. Routine health screening and examination. Pre-entry medical and dental screening. This will assist the evaluation of the health status of a child prior to entering school, that is, before commencing primary, secondary, and tertiary education. A pre-employment medical or dental examination should also be conducted for all other members of the school community, including food handlers. Pre-entry medical screening should be done by trained health personnel. Purpose of pre-entry medical and dental screening: to make a comprehensive appraisal of the child's health status, to discover defects, to give valuable information to parents and school personnel, to provide professional counsel for any existing deviation, to indicate the extent to which school health program should be modified to benefit the child, to determine the fitness of the child to participate in the school programs. Components of pre-entry medical and dental screening: 1. Physical examination. 2. Mental health examination. 3. Dental examination. 4. Visual and hearing screening. And 5. Laboratory investigations, genotype and blood group, urinalysis, stool microscopy, hematocrit Mantoux, typhoid screening. School health record. A record-keeping system provides for consistency, confidentiality, and security of records in documenting significant health information and the delivery of healthcare services. Pre-entry health form containing essential health information supplied by parents and primary health caregiver must be filled and submitted to the school health center. Information from the pre-entry form must be put in the health record card for the child. The health information goes with the learner from class to class. If the learner transfers to another school, the original should go with him and the duplicate should be retained by the original school. Each entry into the student's record must be dated and authenticated by the staff member making the entry indicating name and title. Components of the school health record: 1. Personal and family history. 2. History of past illnesses or hospitalization with relevant information on treatment received and whether follow-up is necessary and being carried out. 3. Records of immunization. 4. Records of screening tests. 5. Records of height and weight taken at regular intervals. This will help in appraisal of rate of physical development of each child. 6. Results of teachers' routine observations. Routine health screening and examination. This includes teachers' observation of child, professional screening, first aid or emergency preparedness, referrals, special needs integration services, and counseling. Teachers' observation of child. The main purpose of teachers' health observation is to enable early identification of those children who require special attention. The specific procedure is to be carried out by the teachers includes periodical inspection of the learners to assess their general cleanliness and detect discharging ears or eyes, squints, unusual color of eyes, inability to see the blackboard, inability to hear or read properly as appropriate for age and skin rashes, early detection of tooth decay and bad breath. Learners observed with such ailments as above should be referred to the school health center. Measure the height and weight of children at the beginning of every school term. Results must be sent to the school health clinic within 48 hours of measurement for recording into the child health records file. Periodical observation by the teacher should be carried out at the beginning of every term. Professional screening. Visual screening to be done periodically at the School Health Services Center at the beginning of every session. The visual acuity test should be done in a well-illuminated room using the Snellen chart. Each eye is tested separately. Any child with squinting, tilting of the head, and visual acuity of less than 6 or 9 in one of both eyes should be referred to the specialist. Hearing screening, to be done periodically at the School Health Services Center at the beginning of every session. The pure tone audiometer will be used for assessing hearing acuity. This tests acuity at tones of various frequencies, pitches over a wide range of intensities, loudness. Children with diagnosed hearing loss are referred to the specialist. Dental or oral health screening, to be done as a preventive and appraisal measure every 6 months at the School Health Services Center by a dentist. The oral examination, especially the DMF, decayed, missing, and filled teeth index, should be recorded into health record file. Those identified with oral health problem should be referred. Regular deworming exercise should be done at least once every 3 months. Routine immunization and missed opportunities. Provision of booster doses of relevant vaccines should be available. Food supplementation, e.g., vitamin A supplementation. First aid or emergency preparedness. Teachers and learners shall be trained in first aid. Provision of a standard first and boxes with the following content: iodine, crepe bandage, plaster, cotton wool, small scissors, paracetamol, gauze, gentle violet, glucose, etc. Referrals. Pre-identified nearby health facilities should be used. Provision of pre-identified means of transportation. Special needs integration services. This refers to adequately catering for children with special needs or disabilities, e.g., provision of walkways for wheelchairs. Counseling. There shall be full-time counselors in schools to offer counseling services to the school community and parents in all areas of living. This should be done in a private room, which is counselee friendly. Counselee can be self-referred or referred by teachers. Learners should be encouraged to see the counselor as a matter of routine. Counselor should also arrange to counsel every learner at least once during the school year. Strategies of implementation of SHS. The key strategies for implementing school health services include advocacy and coordination. Advocacy to states, LGAs, PTAs, communities, development partners, etc. on health services in the school community, formulation of health-related policies in schools. This refers to rules of practice, e.g., prohibition of smoking and substance abuse in schools, strengthening of existing coordinating mechanisms at all levels of government for school health services. Capacity building. Training of teachers and other categories of staff on medical and dental health screening and examination. Orientation of health workers to support school health services. Provision of health service facilities in schools for use by schools by relevant authorities. Control of communicable diseases. Exclusion of children with contagious diseases from the larger body of children. Insisting to parents or guardians that children get fully immunized. Closure of school in times of severe outbreak of infectious diseases. Partnerships. Public and private partnerships for the implementation of SHS should be employed. Monitoring and evaluation. Effective monitoring at local government, state and federal levels. Study session summary. In this study session, we discussed organization of school health services and stated the minimum requirements for setting up a health center. We also explained the elements of school health services. End of study session 11.